Hey, what's up everybody? This is Dr. Ryan. This is your 5 Minutes of Fire today. Today's all about low back pain. You know, it's one of the most common things that I see as a chiropractor, and I think a lot of low back pain stems from really tight hip flexors. And so, big reason for that is because we sit so much. When you add up your morning routine, breakfast, driving to work, sitting all day long at your job, coming home, sitting down for dinner, sitting down to watch TV, for most people it's 80 to 90% of your life. And we know that, sitting is the new smoking just because it destroys your spine, your nerve system, and ultimately your overall health, not just chronic low back pain, which is a pain in the butt. I get it. I've suffered for years from a fracture in my lower back from way back when. So all I can really do now is just manage it. And I've done a pretty good job. I fractured my back when I was in middle school. But by doing things like I'm going to show you today, I've been able to maintain a pretty tight core and a pretty high level of function. I've done 6 Ironman races, and I continue to do CrossFit and all this type of stuff. And I still have some pain, I'm going to be honest. But I realize that there's a limitation of matter. So this is just one thing that I've been able to implement in my own life, and I've given to thousands of patients now that help with chronic low back pain. And again, the intent is to stretch the hip flexors that get really, really, really tight, and then by having tight hip flexors, it throws off the biomechanics of your lower back. And so what we're going to do today is you're going to find a surface just like this. So I'm in my garage gym, but you can do this with a dining room chair or your couch or anything that's about this height. But you're going to put your knee on the ground just like this, and then you're going to put your foot up on the surface of the chair or the table or the bench, and then what you're going to do is you're going to lean into your heel this way, so you're pushing your butt towards your heel. So that's going to stretch your quads at the knee and from the knee up. And then you're also at the same time going to push your hip and your stomach out. So I know it's kind of, opposites, but you'll see the motion here. As I lean back, I'm also pushing or extending my torso this way. So basically what this stretch does is it stretches the muscles over 2 different joints. You've got your quads at the very end of the joint where your knee is, and then your quads go all the way up, and then they start to turn into or connect to your hip flexors. So that would be like your psoas muscles and the deep core muscles that control your lower back posture and the stability of your pelvis, which gets really tight when you sit a lot. So by pushing your hip out like this and then leaning back so that you're going towards your heel, you're going to feel that stretch all the way from your chest, all the way down through your hip, into your quads, and then across your knee into your lower leg, and that's a phenomenal stretch. And then the next level of this is if you take your arm, same side as the side you're stretching, and then you extend and bend the opposite direction. So now you're going to get that stretch all the way up into your lat muscles and your serratus muscles. And you want to hold this and continue to stretch further and further for about 2 minutes. We know that a 30-second stretch isn't going to do anything for you long term. You want to do this for about 2 minutes, and then you want to switch legs. And I'll tell you, if you do this right, you got to be careful getting up because your hip flexors can be really sore, which is a great thing. But I can tell you, just doing this 2 or 3 times a week for 2 minutes on each leg, you'll notice a huge difference with your lower back pain, your posture, and your ability to just do your activities of daily living. So I hope that helps you today. Go crush it. See you next time.